what this is about is building our response capacity. This has been an issue that has tested our capacity, that has allowed us to innovate and strengthen our systems, and ultimately enabled us to ensure preparedness as far as pandemic management is concerned. Lagos, has been the epicenter of this, and it has managed this admirably and probably become a leading response capacity in the whole of the world as far as COVID-19 is concerned. And across the 36 other states, we have managed to strengthen our health capacities, particularly at the primary healthcare level, and also our diagnostics capacity. When they started, there were only 4 molecular laboratories in the country. Today, every state has at least 2 molecular diagnostic centers for testing alone. And that has gone a significant way to enable us manage this a lot better. Are we fully over it? Not at all. You know that the pandemic is still here. We're now focused more on vaccination and ensuring that vaccines reach our people. In the world, they talk about vaccine hesitancy. That's not our issue here. Our issue is vaccine access, and access to our communities, access to our most vulnerable segments of the population, access to enable us get on with the job so that the economy that has been dragged down as a result of COVID-19 can begin to rise again, and our people can begin to live and breathe.
Global conversation at the local level where experiences are being shared, lessons are being learned, and we all, locally, subnational and international can indeed, build back better, like we say. So we've shared experiences, and we've been able to identify real partnerships going forward. But for us, it's really around being able to increase our capacity. It has afforded us an opportunity to wrap up our infrastructure capacity, access, improve more budgetary, numbers to health, and generally appreciate, one another, and ensuring that we can build, an ecosystem where people will be safe. Our health institutions will be stronger, will be better, and we can reverse anything around, medical tourism, But speaking around, infectious, pandemic like this, it's not wishful thinking to say that at some point in the future, one will also occur. So the question is, what are the lessons and the learning coming out of this? How are we better prepared, for another one when and if it does happen? So it's like you're building capacity, redundant capacity, and that's one of the things that we're talking about. And for Lagos, since we realize that we're the epicenter, we continue to receive international travels, both at land border and sea border, right? We needed to think out of the box and ask ourselves, what do we need to do? So one of the things that we're doing, we're going to build what we call an African or a Lagos infectious disease research center, which will be purpose-built for future, learning and teaching of how pandemics or how diseases that of high consequences like we've seen of COVID, when it does happen, or what are the steps we can take when it's going to happen. So that center, we feel will be a big resource, center where, researchers, all sort of academia, all sort of people will come together and begin to, ventilate and study and, make prognosis as what do they see, so that in the event of one, we can have what we see happening in India. We can have our own serum lab where we can develop vaccine. We don't need to wait, for the likes of Gavi and COVAX to come and prepare vaccine for us. It will be, a capacity that we have developed, and we can develop, local, vaccines or local understanding, of the type of infection or kind of disease that will raise the head up, and it will help strengthen, our ability to respond quicker, faster, and better in the event that, that it happens. So what COVID has done for us, it has helped all of us, to think stronger and to be able to prepare for the future, knowing fully well that that could happen, at some point in time in later part of life. Because our children will ask us, what did we do? What were the lessons? How do we ensure that they could live a better life in future? And that's some of the things that we're doing. And that's why we're having all of this engagement and partnership, so that the world can become a better place. We can very well learn from what COVID has done for us, and we can position ourselves. We can help, our health institutions. We can help our health infrastructure. We can develop our primary health, institutions, and we can do everything to keep our people, our citizens, and our nations well, from events like this.